Hello everyone, welcome back to Veterinary 101's channel. Today we're going to be talking about bee stings and allergic reactions within felines, how they can be treated with first aid and how they are dealt with in veterinary clinics. Bee stings and allergic reactions. Bee stings are common injuries amongst animals that spend time outside, especially during the summer months. They occur when an animal, in this case a cat, plays with an insect or tries to eat one. Hence why they are common injuries found on the paws and on the face. Symptoms of bee stings are hives, swelling and itching. Bee stings can lead to allergic reactions which can have severe impacts on breathing and sometimes lead to death, so they should be treated quickly. Equipment needed. Equipment required to treat a bee sting from home during first aid would be a blunt object such as a bank card that can be used to remove the stinger. These are recommended because they do not break the stinger, which causes further infection. However, they are not sterile. A cold compress to relieve pain and reduce swelling, but it is not always the most effective method to reduce these things. A pet carrier to transport the animal to a veterinary clinic without allowing it to escape. Pet carriers can be very stressful to get cats in for both humans and the cat. A veterinary clinic would need the following equipment to administer nursing after initial first aid has been given. An oxygen mask or tube to help the animal breathe if it is suffering with a swollen throat due to an allergic reaction. This is not going to help the swelling and could in fact worsen it due to irritation. A pulse oximeter to measure the amount of oxygen in the bloodstream can be inaccurate due to skin pigment and human error. Antihistamines to reduce the symptoms of the allergic reaction. These are effective in most cases, but human error can occur when measuring dosages, which can have an impact on effectiveness. A cat muzzle to reduce stress and the likelihood of getting injured by the cat when administering medicines or nursing. Would not be effective working with swelling and could cause discomfort because of this. A towel to restrain the cat in a less stressful way and eliminates the risk of being scratched as well as bitten. Non-conforming bandages used to keep the cold compress on the site of the sting can be uncomfortable due to the non-stretch material. It will keep the compress on firmly, thus making it more effective. Syringe and needle used for immunotherapy to fight against bee sting venom reactions. Effective equipment for administering medication but can cause pain and slight discomfort. First aid. First aid. The first thing to do when your cat has been stung by an insect is to perform Dr. ABC. This will make sure the animal has clear airways and good blood and oxygen circulation, which is essential for life. If there is no issue with either the airway or circulation, then you may proceed to checking the site of the sting or bite. You should be looking for stingers, swelling, redness, or a rash. Once the site has been found, it is important that stingers are removed to reduce the chance of infection. This can be done by sliding a blunt and thin object around the stinger, such like a bank card. Using a blunt object can eliminate the risk of the stinger breaking while removing it, which, if to occur, would cause more discomfort and cause more venom to be released into the cat's body. Once the stinger has been completely removed, a cold compress should be applied to the affected areas to relieve some pain and swelling. This should be held in place using a non-conforming bandage. This is the most effective way to hold it on. After this, the cat should be monitored for allergic reaction. Signs of allergic reaction are pale gums, vomiting, swelling round the face and neck, and difficulty breathing. If any of these symptoms occur after the cat has been stung by a bee, they must be transported in a pet carrier to the nearest veterinary practice immediately. Veterinary care. Once the cat has arrived at the veterinary practice, consent forms and upfront payments will be covered with the receptionist. The veterinarians will perform another Dr. ABC to make sure that the airways are not blocked and that the cat's blood and oxygen is flowing around the body properly. If the cat has pale gums, that can be a sign of blood loss, anemia, or allergic reaction, which means the cat will likely be put on antihistamines to treat the allergic reaction symptoms. After this, if the throat swells leading to and causing suspected breathing difficulties, the veterinarian nurses will use a pulse oximeter to measure the oxygen levels in the blood. If oxygen levels are low, a breathing mask or tube will be fitted to supply the feline with efficient amounts of oxygen. The cat will be given more doses of antihistamines to reduce the symptoms of the reaction until it is gone. Post-operative care. Post-operative care for this specific cat includes being tested for insect and bee venom allergies. If the veterinarian thinks it will be beneficial and that it is necessary for the cat's welfare and safety, it will receive a course of immunotherapy treatment over the span of a year to reduce the effects bee venom can have on the cat after a sting. It will not eliminate the reaction, but it will severely decrease the effects of the reaction and venom on the cat. The immunotherapy drugs will be administered into the back of the neck via a syringe, so the cat will need to be restrained using either a towel or a cat muzzle. The client will be given antihistamines for the cat in case this happens again and will advise them to reduce the amount of time the cat spends outdoor during the summer months.